In Longford, there's been 2 teen suicides in the last 2 years, and it's clear that mental health issues are prominent in our area. However, there are many services in Westmeath, but can you identify the mental health services available in Longford?
Now, May, I'll open
Well,
it up
again,
to you.
I made reference to it earlier. I think it's absolutely scandalous that we do not have the proper mental health services here in Longford. It is absolutely scandalous. You have them in Athlone available. We need them here in Longford. We're entitled to have them here in Longford. And I don't understand. It's not like some services that perhaps can be centralised. You cannot do this about mental health because anything can make you feel near the edge, and you need to have a quick reaction and a quick response. And I'll just say one other thing in relation to the gentleman that asked, the young lad that asked, should you be involved in politics? Absolutely. The Court of the No has been fantastic, and eye-opener to me to listen to everything. You have driven the bullying campaigns, the LGBT campaign in Longford and Westmeath, and indeed for countrywide. You're opening the eyes of your elders, I can tell you, and you're clued in far better than we are, and it's wonderful to have you snapping on our heels.
Can I bring you back to that question? What mental health services are in Longford, and what would you do if elected? What would you bring to Longford?
I promise you,
and how would you bring it?
They will be in Longford. And let me tell you, I have done no canvassing in Westmeath, and with apologies to the Westmeath Forum that might be here today, as far as I'm concerned, Longford has been denuded of everything. I am not canvassing there, I have not sent literature there, my entire focus is on Longford. And Longford has got to stand up for itself, and the people of Longford have got to stand up for themselves.
I
give you my word. I give you my word.
Can you identify what services are?
When you don't even have the most basic, you have a 20-week waiting list if you want to see somebody, if you have a mental health issue. Your GP being your first port of call, he tries to get you an appointment, and unless you leave this county, you can't get that. That is not fair nor proper.
Okay,
not fair.
right, I'm just going to repeat the question.
What are they? I don't know them. I don't know.
We do
have a very basic mental health support service here in Longford, which is on Dublin Road in Longford. I think probably one of the better supports that has come to Longford in recent times is Good Talk. Now, aside from that, there really isn't much else. But I just really need to ask this question back. The statistics show that mental health is increasing among our young people, and we have to ask not where the supports and services are, I should say not just where the supports are. We have to ask why. What is contributing to young people feeling that they can't cope? Is it the social pressures? Is it their own lack of confidence? Is it inadequacy to cope within their own circumstances, in their schools, in their social environment? But also, and somebody mentioned here today, and I have to say this, someone mentioned that because of the lack of other interactions, that people are smoking weed and are resorting to drugs. Now, you have to start, as young people, you have to start speaking about this ethically and morally and looking at the impact of drugs on yourself. I have seen, because I work in the community and voluntary sector.
Carrie, I'm going to stop you. No, sorry. I have to get through the vote.
I have to say this. I just have to. I have to say this. I have to.
Don't make me have to say it as well, Connie.
I have to say this. I really do have to say this. No, I have to say this.
Well, hold on.
Recreational drugs.
1 second.
Hang on a second. Just remember what you are.
820 words between the 4 manifestos of the major parties were allocated to mental health. That's how important between the 4 major parties that mental health is. That's a fact.
Connie,
You don't care because there's no votes in it.
With respect, the only services in Longford is Lee.
I have to say one thing.
The only psychologists out there make you sit in a blank room.
Yes.
The only ones in Longford is Lee, because my cousin died 2 years ago through suicide, and the only help I got was through Lee.
But we have to start.
They're not qualified psychologists. They're general news workers like
Please let me say just one thing, I'll finish on this. There is a huge problem, and I've seen it in the community sector that I work in, where there are young people, academically very bright, and they are taking what we call, immorally calling, recreational drugs. There's nothing recreational about drugs, and I'll tell you why. You go down the road and they cause psychosis, bipolar,
It's a fact of life, Connie. It's a fact of life.
It does not counteract with the lack of support that are available in Longford. The mental health services that are here in Longford will not work with young people who have several issues. So young people who have drug issues and mental health issues, they work in isolation. And these issues come together.
But that's what I'm saying, we have to deal with what is causing these.
Which is what the schools and youth workers like myself are trying to do across the county. That is what we are doing. I am one person that does drug education across the entire county. How many thousand young people? That is, it does not work. It doesn't work. How can I be here in Longford?
Okay. Thank you, Teresa. We've identified, just 1 second, Dawn, I'll let you in now. We've identified that there is a problem here. Unfortunately, not one of you there has a solution. Now, as standing as a candidate, you should have solutions, you should have a manifesto. This is a major thing in Longford. You should have it, okay? So we need
Don't say that, no, don't say that. The Green Party have a full manifesto.
I'm getting to you, I'm actually going to get to you, and I promise. But Donald, you want to get in here quickly on this and then launch it, okay?
To answer the question honestly, I couldn't tell you what's here in Longford Park. I'm the chairman of a charity, and we deal specifically with people who are coming off drugs and alcohol, and we try to drive them out, we try to re-employ them. We're looking at a place down in Grand Canaria now to buy, so that they can go and get, with a house parent, get some time out to get themselves strong again. So I see the effects of drugs. However, I also see that when these people come out of this, they're very, very strong-minded people, right? And you have to ask the question why they got into it in the first place. And they'll all say the same thing, and you tipped on it earlier. There's nothing for you to do. So what I suggested earlier with regard to, now, another thing, you're all old enough to know you're not going to get mollycoddled all your life. You know the problems you're walking into. So with the suggestion that you could go somewhere and work for your tax credits, there's a future there. You've got to stand up to this. Now, I understand that there's no real
Sir,
Okay.
you were the first person to tell us this. We haven't been told nothing. We are expected to go find our own work, find our own. We have to be 16 before we're insured to work on the place.
Yes.
We spend our summers doing
The
that.
point I'm making to
The
you,
only things we
I
have
understand.
is around the town.
I understand, and you, as adults, never mind as politicians, the adults in your community and mothers and fathers in the community should be demanding this. Now, you're not going to get it from this current government. Now, this is the political bit. These people have prioritised their money, they're telling you lies about recovery, and the money that they have is not for you. It's not for the services that you want. You understand?
Okay, Donald, I want to get to Moncon. Would you mind?
So the Green Party have allocated, they came out with their manifesto last week. The idea is 35 million extra into mental care. What the idea is, implement first the 2006 Vision for Change, which was all about looking after mental health in the community, emphasising recovery in as local area as possible, and paying for every type of cure, including talking cures, and that being a priority rather than going straight to pharmaceuticals. Then there's the idea of integrating all the elements, so psychotherapy, counselling and social care services within this new, getting away with HSE, creating a new community health service that has as its basis mental health. Again, there's always been this divide between mental health and addiction, so the key is here, we're bringing in addiction services, right into the centre with mental health care and social care. Now, we want there to be authorised health promotion officers in every school. As you're saying, they're not fully qualified psychiatrists, they're people who've just done courses, but at least they're the first access point. The people immediately have within their school someone in the next corridor who can help them and send them to the next area.
But that's what he said as well, but it's youth friendly. You know, that you're not sitting in a room above the HSE that a young person doesn't feel comfortable going to.
You said there was no solution to it. The solution is very obvious, more resources. And if we put those resources in now, it will save us in the long run. It's very obvious.
Okay, Barbara, last point on this.
There is, in schools, it should be introduced that safe talk is taught to our young first years, second years, third years, every year. It's a 3-hour class. It will show you the signs to watch out for. There's also the assist course. That should be introduced in schools also, because it does give you ideas on how to help somebody. You hear triggers. It's one way of just trying to sort it.
Okay, thanks,
Can
Barbara.
I just check, because you know,
Sorry.
the resources are the problem, and that's why I said to you, I would promise you, as your elected representatives, which sure, that in Longford you get that. Well, this government does not have it prioritised now or into the future. But my sister is a senior psychologist in the health board, and like that lady that's working from Ballymahan to Granard, one person in the county. The mental health issues for yourself, trying to cope with all these people that you're meeting at first hand and know that you can't even get referrals for them. It is outrageous, and it shows the lack of commitment to young people until you get to voting age. And then suddenly there's great commitment.
Okay, I'm going to move on.
I just mentioned Jigsaw here, because you've obviously done a brilliant job here in getting this place. Any of you who've seen Jigsaw in Galway, it's a fabulous resource for mental health services.
There is models that work across the country. For example, Froiga in Sligo have a remit where the CAMS, the Youth Mental Health Service, actually come out to the youth work setting one day a week and work there and meet people there on a short-term basis to get them to a stage where they can go and meet them within the hospital setting, which is fantastic. Like, there is models out there, it's just not come to Longford. The mental health services are completely unapproachable.
But we're all talking about the cure, and that the resources are required there. But what about prevention? Why are we not talking about having an alternative for young people so that they're not saying that their lives are so shallow that they need to be smoking
With all due respect, Connie, this is what we're trying to do here, and we're doing it on a roll of volunteers. Like, why don't we have a youth health worker here? They have them in other counties, they don't have them here. Why not? We have a facility and we're relying on volunteers.
We're not talking about the, the prevention and the distraction and the other things that young people can have as a distraction and the support in their lives. We're actually talking about the mental health services afterwards, and that's important too. But we need to be talking at the earlier stage.
Okay, Connie, can I just intervene there for a second? Okay, I can hear what Teresa is saying to Connie, and I can hear what you're saying, Connie. It's about prevention. There's no point curing it. You need to prevent it, okay? And I hear what Teresa is saying. Teresa's saying, but the community have agreed to what you're saying, Connie.
That also requires resources on both sides.
Exactly. They've heard what you're saying, Connie, already. They've built this premises. They're interacting here with 2,500 young people on a weekly basis coming through these doors, working on preventative programs to prevent our young people going down that road.
With no help from government either.
But what can you do as our candidates going forward? How can you prevent this? How can you support the preventative work? That's what young people are asking.
As a member of County Council, and Ruth will bear me out of this, you had a terrible job trying to persuade the county councillors to actually give core funding here. It was a job of serious work to convince them that this is needed in the community.
To purchase this premises, this site and this building, and to renovate it cost a total of 420,000.
Where did the money come from?
I'll tell you now where the money came from. 60,000 of that money came from the county council. 10,000 came from the enterprise board, which funded the fit out of this tech space. 15,000 came from the Department of Youth and Children. It was given to us for a sound studio, which was in part 2 of the development, and originally they wouldn't change on it. We kept insisting, listen, we cannot use this money for that. Please, can we change the use of it? Eventually, the department agreed to change the use of it, and otherwise that money would have been decommitted back to the government, as what happens nationally. And the rest of the money was funded locally here in County Longford.
400,000, did you say 400,000?
420,000.
So that's 335,000 funded locally.
Yes.
And that shows, it shows that is there.
That is there from the community,
but the
exactly.
support from the people who can really provide you with the money.
Thank you very much. You want to get on, Adam?